Hey everybody, Dr. Mike here again. Hope your 2023 is getting off to a great start. I think we look at the headwinds ahead of us this year, kind of the economic uncertainty. We're just still recovering from COVID. I'm still getting a lot of patients that are coming back after being gone out of the practice for about 3 years, and they have really, really deep decay. And what I'm finding is that when I use the Regen restorative materials, the Regen universal adhesive and the Regen flowable composite liner, we're getting some really, really great results. And so I just want to share in the next couple of weeks some of the cases that we've been doing, how we've been using the Regen system, and what we tell patients about it, and why they are so excited about Regen, not just us. All right, so here's a case. And in this case, the patient came in, had been diagnosed by another dentist of having deep decay, tooth number 13. So of course, they gave them the various options. They could try to fill it. They might need a root canal. As you can see, this decay is very deep. And then they could put a crown on it, or even the possibility of an extraction, maybe a bridge or an implant. So all the different suggestions were made, but that were very appropriate. So the patient came in and asked me what I thought. And I said, you know what, I agree with all those options that have been given to you. This decay appears to be really deep radiographically. I would say there's a very good chance that we're gonna either be in the nerve by the time we remove the decay or be very close to it. So, the need for a root canal and extraction would be very high depending on what she chose to do. So she said, I hope that we don't have to do a root canal. And I said, I hope that too, but I can't really tell until I get in. So what we did is we numbed her up. We opened up their decay, and as you can see, it's quite extensive, both to lingual and to the buccal sides. And when I first got into it, I saw a little bit of red there, and I told her, unfortunately, I think we are right into the nerve, and we're still taking out the decay. And I told her, I think we're looking at either doing a root canal or extracting the tooth. So she said yes to the root canal. So I said, okay. So we get everything set up, and I go in there and do some more decay removal. And when I got all the decay out, as you can see in this picture, you can tell we're really deep, but things look pretty good. So I told her, you know what? We've got a material, and this material actually will help the tooth heal itself up, and it'll help protect that nerve. So where I thought we had exposed the nerve originally, I don't see a nerve exposure. So, worst case scenario, we put a filling in there, and if the tooth bothers you after that, we can always do a root canal, but why don't we try with a filling first? And she was very happy about that. So we got in there, removed the decay. I placed my matrix just to protect the adjacent tooth contact from our etching. I placed velvet etch into the tooth for about 10 seconds, rinsed that out. And then I didn't use a desensitizer in this case because I really wanted our Regen universal adhesive with its bioactivity to be right there in the dental tubules. So what I did is I took the Regen, I saturated the dentin with the Regen universal adhesive. Now, what I'm thinking I'm doing is almost like a vital pulp cap. And in order to do a vital pulp cap, you have to have a really good seal, which means your adhesive has to be really good. You have to have really good bond strength to the dentin and to the enamel, so you seal it all up, and you have a restoration that's not going to be moving. And then the bioactivity on top of that. So something to help the tooth heal up. So that's what we did. So then we put the flowable composite liner, which is a reservoir of that bioglass, right over our adhesive, and then we light cured both together. Now, I took that flowable composite liner right to my gingival floor margin, where it'd be exposed to acid at that gingival margin, that difficult area to keep clean. And again, our bioglass and the bioactivity in the bioglass is going to help to neutralize that acidity. So I cleaned all that out, then I placed the composite flowable liner, so again, it was exposed. Then I light cured my Regen universal adhesive with that Regen flowable composite liner. Then I placed my favorite sculptable composite over the top of that and adjusted the occlusion, and we were done. Now, one of the key things is I tell the patients, I go, not only do we fill that cavity with a filling material, but this filling material actually will help the tooth heal itself. So there's a good chance we are not going to have to do a root canal in this tooth. We've been using Regen universal adhesive and the Regen flowable composite lining material like this for over 3 years. And I see the same results over and over, where we're taking these areas of really, really deep decay, and I'll show you more of these cases in the following weeks. But we take these areas of really, really deep decay and place our Regen bioactive materials right up against that close pulp exposure, and we're getting some amazing results. Patients are really happy about it. A lot of times patients will say, hey, you know what? I would pay you more to use that material. And of course I tell them, you know, we're not going to charge you more. We just always like to be sure that we are using the best materials in our practice. And it improves their dental health and saves them a lot of money. So again, Regen Universal Adhesive with the Regen Flowable Composite Liner in our practice is working out to be a great combination. You guys stay healthy and take care. Thanks for watching.